When we listen to the heart, we hear two sounds, usually referred to as lub-dub, and they are associated with heart valves closing. So what we're hearing, the first sound, the lub in lub-dub, is when the AV valves, recall the atrioventricular valves, those are the tricuspid and mitral valves, they are closing beginning at ventricular systole. Recall when the ventricles contract, they force those AV valves closed to prevent backflow to the atria. So that first sound is the sound of the AV valves closing almost simultaneously. And the second sound, the dub in lub-dub, is the closing of the semilunar valves, which are the aortic and pulmonary valves, beginning at the beginning of ventricular diastole. When the ventricles relax, then that blood begins to backflow from the aorta to the left ventricle, or from the pulmonary artery or trunk to the right ventricle, and that backflow fills up the semilunar valve cusps, causing them to close. So that second sound, the dub, are the SL valves closing. They close at almost the same time. So the pause between the lub-dubs, because we have lub-dub, pause, is the heart relaxing in total. So when we use a stethoscope, we can auscultate, that just means listening using a stethoscope, the four different valves. The lub, which are the AV valves, including the mitral and tricuspid valves, well, how do we isolate those sounds? They actually are slightly apart. So the lub is two quick lubs and the dups are two quick dups, but the mitral valve and tricuspid valve, we can listen at different areas of the chest, and you can see it right here, tricuspid valve in this location on the chest, and there it describes exactly where, and here's the mitral valve at the apex of the heart. There we can listen specifically to each AV valve. Same thing with the semilunar valves. The dups, they actually occur just a split second apart, even though it sounds like one sound. But if we want to isolate the sounds, well, there's the aortic valve location and the pulmonary valve location. If abnormal sounds occur while auscultating, those are called heart murmurs, and often they indicate a valve problem. If valves are incompetent, that means they're allowing backflow. When valves backflow, you hear that regurgitation or that swishing sound as the blood squeezes through the faulty valve back into a chamber which it wasn't supposed to backflow into. Valves could become stenotic, and stenosis means narrowing. If valves narrow, then when blood gets pumped through them, there's some turbulence as the blood tries to rush through these narrow valves, and you get these high-pitched sounds, sometimes clicking sounds, as blood is forced through the narrow valve. So heart murmurs can be heard on auscultation, and typically they indicate valve problems.